How are you guys doing on the marathon? This is like the 16-mile. Anybody run a marathon here? Yeah, you know what the 16-mile mark is like? You know, you get there and say, God, I haven't run 16 miles, but 10 miles more. You're my 10 miles more.
Hello there.
Hi, how are you? You seem like you'll be a fun 10 miles. Thank you so much for doing it. You know, I have taken a quick look at your considerable resume and all the things that Stand Up to Cancer is doing, and you're kind of like the Wonder Woman of cancer right now, right? Do people call you that?
I wish I was a superhero, but I leave that to the scientists.
I mean, I want you to share with our audience some of the new therapies, the new methodologies, the new dream teams that you've basically been bringing about. And honestly, I mean, what I worry about in this question is it all sounds so optimistic. Is there a point where we can kind of think that there may be a cure to cancer, that this may become you know, such a much more of a manageable disease given the very positive trends that Stand Up to Cancer is helping to generate?
You know, it's a great question, but I want to start from the beginning and just set it up for the audience. How Stand Up to Cancer was first created. It was created on the notion that there was enough basic discovery science and technologies to really take advantage of that for proximal translation. And in order to do that, the 9 co-founders realized after talking to many of the scientists and leaders and innovators in the field that scientists like to work in silos. There's not a lot of collaboration. There's bureaucracy in terms of grant funding. And also, what was very, very evident was there wasn't real-time data source sharing, right? Information sharing. So they want to set up a new funding mechanism. And it's what you hear, dream teams of scientists working together in collaboration. It's multiple institutions, multidisciplinary approach, and it's really working. We have 1/3 of our scientific portfolios invested in immunotherapies. And I remember, you know, before we went into the route of launching a dream team in immunology, people were like, it's nascent, it's not going to work, I think this is going to be a huge mistake. But our scientific advisory committee members said, you know what? We're seeing blips in the scientific literature. Let's pour the Stand Up to Cancer steroid. Let's make the peaks as tall and wide as possible. And we've worked with our pharmaceutical colleagues, our scientists, and when you see what's happening in immuno-oncology.
And you work with a lot of firms.
We do. We work with 77 industry partners, and that's about 150 plus collaborations within our dream teams.
Wow. When you're in that area and say in immunotherapy, and Sean Parker, who many of us may remember either from Facebook or was it Napster days, kind of a naughty IT boy, he came in, has pumped a ton of money into immunotherapy. Is that something you welcome, or is that something that is a rival to what you do?
We welcome that. And by the way, Sean Parker was an initial investor for Stand Up to Cancer.
Oh, I didn't know that.
We convinced him to give us a lot of money to help fund our immunology trials.
So Sean Parker bought the chocolate muffins outside, right? But you know, in that, do you look at these? How do you look at some of these other terrain changers? And I guess what I'm really interested in, you know, I've been at Davos the last couple of years and been at the Biden moonshot, both when they brought together companies like SAP, data companies, Google, scientific researchers and oncologists, and said, we need to break down silos and get, you know, some odd bedfellows together. But it sounds to me that that's already what Stand Up to Cancer is doing.
We are doing it. It's called the Convergence Initiative, and several years ago, Dr. Phil Sharp mentioned that we're not really galvanizing all of the disciplines, especially the physical scientists, you know, the mathematicians, the theoretical physicists, biomedical engineers, really working in collaboration with biologists and oncologists. And Steve, I have to tell you, if you've ever been to a junior high dance where you have all the boys on one side of the room, all the girls on the other side, it was sort of like that, our inaugural meeting with physicists and oncologists. But You know, learning each other's language and understanding the unique discipline and the disciplinary perspective they bring to the problem of cancer. It really helped them to develop some interesting problem-solving capabilities.
So how do you take all the stuff that you're doing there, and I've got a long list, the immunotherapy, the conversions, the SUTC catalyst, can't even begin to describe all this to all of you folks, but how do you take this immense work that you're doing and the breakthroughs you're doing and make it real? And you know, we're in Nevada, which is working very hard to sort of look at building new infrastructure, what sorts of best practices, what sorts of networks it needs to promulgate therapies and actually build literacy and also create greater access channels. So how do you take all this stuff up here and move it down here into a practical, real-life way that would impact, say, Lisa, that was just on stage with me?
And you know, that's a discussion we've had, you know, numerous times within our scientific advisory committee level and also at the co-founder level. We are extremely collaborative, and I think it was baked into our DNA when Stand Up to Cancer was founded. The 9 women who co-founded Stand Up to Cancer, they all wanted to do different things. All they had as a commonality, they were sick and tired of the pace of cancer research in this country. The late Laura Ziskin, when she started Stand Up, was battling metastatic breast cancer. And she was often reminded that her prognosis was no better today than it was 40 years ago. So if you think about the fact that these 9 women joined forces to collaborate and create Stand Up to Cancer, and then 9 women marching into the offices of network executives to demand airtime. In the entertainment industry, having networks who are fierce competitors collaborating and sharing airtime for a telecast, it's as good as it gets. So if you think about the types of collaboration that these ladies mandated, it's crossed the scientific community as well. The rapid translation for benefit of patients, we have a mantra at Stand Up to Cancer. It's not science for sake of science, it's science for benefit of patient. Everything that we do to accelerate the pace of cancer research so that we can work with scientists, pharma, patient advocates to get near-term benefit to patients quickly as possible.
I'm trying to keep throwing you off your game, and it's hard. This SUTC catalyst, it's interesting because you work with Merck and Bristol Myers Squibb, who's underwriting today, Genentech, in trying to create more effective treatments and combinations, speed up things. So let me give you a quick take after having done hundreds of these forums. I feel like I've done hundreds of these forums. Is not everything's a good story, that there are companies out there that aren't doing what BMS and Genentech are doing. There are research centers and cancer centers and important research institutes in the country that are not wanting to share their data. Data is such a key part of what you do, but when it comes to kind of getting data outside of an institution and putting it into a commons, that's not happening at the level. And I use excuses like HIPAA and others for that reason. So I'm just interested in your take on the not so good stories, on what certain players are not doing. Sometimes there's frustration with the FDA and the slowness of that. What are the things broken in the system, not working in the system, that you think deserve a little bit of spotlight?
So I want to give FDA a lot of credit. I don't think they're slow. I think they work very hard to get new therapies approved in a safe and efficacious manner, obviously. I think that if there's something broken, it's not Stand Up to Cancer's mantra to let it go. We address it, and I'll give you an example. Stand Up to Cancer scientists had the first triple novel combination therapy protocol. And we had 2 pharmaceutical companies say, yes, we will give you the drug for free, and we'll also give you monies to help support the trial. The 3rd pharmaceutical company said, we're not doing it. So we said, okay, no is another opportunity for a yes. So during ASCO, we had their chief commercial officer, chief science officer, and their senior directors who understand the compound and the science. We had all 3 drug companies represented, and then we locked the doors, and we had the scientists present. And I remember we were heated, debating, and it wasn't easy, and I happened to be going to a meeting, and the meeting wasn't finished, and my casual comment that I made as I was leaving was, you know, guys, wouldn't it be great if you woke up tomorrow morning, Wall Street Journal headline said, 3 pharmaceutical companies caught doing something right. And then I left. I wasn't media trained then. What can I say?
Next time, give me a call. Cancer interception really intrigues me, and this is another one of your pillars. Tell us about cancer interception and what's going on there.
Well, it's a really exciting area, and Nobel laureate Dr. Liz Blackburn coined that phrase, cancer interception. And it's just like football. I have to tell you, I was at CVS, and someone was throwing a T-shirt. I jumped, caught it, and said, "That's interception, folks." And I have to say, it was impressive.
If you do say so yourself. Yeah.
But, you know, it's an opportunity for us to look at cancers earlier and earlier, at pre-malignant states, and not letting it go all the way toward metastasis. When there's less mutations, I think it's easier to treat. And we didn't want to just talk about it, cancer prevention and cancer interception. We held a summit last year in November and decided to put our stake in the ground and do more funding. And we raised about $14 million and launched LOIs, letters of intent, for 2 very specific dream teams, one in lung cancer and the other in pancreatic cancer. And in November, we'll be announcing those selected teams.
Have you taken a look at anything that Craig Ventnor is doing in his new health center in San Diego, which sounds similar in a way, in part to this cancer interception, where you're looking at the DNA and basically taking the genetic code of someone and beginning to look at what probabilities or what possibilities out there. And Craig's big campaign right now is that every doctor should be fired in the United States or the world who looks at you and says, "Oh, you look healthy," because it's actually a completely, as he sees it, and these are his direct quotes, you know, complete, as he said, an asinine way of trying to assess someone's health, that you've got to go into other markers and have a scientific understanding. But our health system, when you go in to see the doctor, so much of it is based on physical appearance. So if you've paid, you know, a healthy $25,000, you can march down to San Diego and go through his complete system and see what your genetic predispositions are, including on things like cancer. Is that where the industry is going? Do you see that as a smart course, or do you have an alternative?
I think that's a very smart course. I don't think it's going to be one thing that will put all of us out of business. It's going to take different levels of collaboration and deep collaboration to make it work. Just going back to the catalyst, you know, that is a iteration of collaboration that we learned from our past Dream Team approaches. When our scientists had really great ideas, took combinations of therapy from 2 separate pharmaceutical companies, the momentum in which we were able to get funding and drugs took about 18 months. And if you think about just the statistics of cancer, 1,600 patients will die today, yesterday, tomorrow. That 18 months doesn't seem like a good thing. So we approached our collaborators, Merck, BMS, Genentech, and they immediately said yes and said, okay, let's try to accelerate this pace. Now we're able to give our scientists a go, no-go decision from a letter of intent to the time that they know they have funding and drugs into 3.5 months. And that's collaboration.
Wow.
That is
Wow.
working together,
So I
hand in
know you're
glove.
looking at science and research and providing this and providing the collaborations that spread these technologies through the system. Have you seen any self-initiated regions, so geographic regions of the United States that have, like Nevada is trying to do, move the needle in ways that were very dramatically, demonstrably helpful in what you're doing? Have you thought about it in terms of the disparities of incidence of cancer or communities doing something that actually might help them move into a more healthy position?
Well, I think, technologies with MIT and Boston, it's just incredible. The single cell analyses that they're
Right.
doing, they have rich collaborations with machine learning, AI. Stand Up to Cancer is all about tapping into what's already successful and trying to accelerate that path for patient benefit. So we do keep track of all of those, but I'm going to quote Phil Sharp, who said, every time we have ideas internally, we're limited by them. So what we like to do is take a more open approach. We like to send a call for ideas to our 70,000 scientists, friends all around the world, and ask them to submit their best and brightest ideas.
Wow. And have you had much activity in Nevada, the scientists in Nevada?
So I've met a scientist here who I knew from
That
USC.
you recruited to the network? Yeah.
But, I always tell scientists and oncologists, if you don't apply for funding, you don't get funding. So I encourage everyone to apply.
Parvesh Kumar, we'll have to get you connected to him. Let's open up to the floor for comments, questions from all of you. Yes, right here. Yeah. We're going to bring you a microphone.
Hi, thank you. Are you going to hold it, or you want me to hold it?
Yeah. They're just
Fine,
afraid you
I
might
might
be
drop
this
the
crazy
thing.
guy.
I might drop the thing.
Yeah.
Hi, I'm Walter Goldstein. I'm a
Yeah.
resident of the community. I'm still working, though my wife says I should retire.
Sure.
I'm a chemical engineer. And I was just thinking about the area of applying something to cancer from my field.
Yes.
Chemical engineering deals with transport of things, going into cells and other
Sure.
things, big pipes, and catalysis, how things react. And it's a way of thinking, it's a way of modeling. And if I thought about how cancer grows and what happens to it, I get ideas in my head. And so I'm thinking that kind of thing ought to be tapped. What you're talking about and what other people talked about. I had an instance, I think the big thing with this area, somebody gets this dreaded thing, you need to have a group of people around you. The doctor can't do his job alone. It's too much. He's inundated. You need a group of people, friends, family, and I just did this once for a friend of, a sister of my son's girlfriend. And not alone, a group of us.
Right.
And we really didn't necessarily know what we were doing, but we need to find some way for the best treatment, the best center, the best doctor, and what was known about her disease. So we each attacked it. The biggest problem, I think, one of the biggest problems was the internet. You needed to get papers so you could read things, deep technical papers, things you might not understand. You got to study for a while. We all did this. It's trouble accessing these things. We had to use ingenuity to get them. The lady who was the sister, she's an attorney, and she had access to LexisNexis or something. And so we got papers. Even she couldn't get papers. Once we got everything, the end of the story is Massachusetts General Hospital was the perfect place for her. She had a kind of cancer. I was telling somebody up on her upper palate.
Shorter form, Walter.
Sorry.
Yeah.
Anyway, the end of it is that she's good from all this. We picked a place to go that's best. We tried to understand the radiation a little bit, and we understand how this thing is done. There's a solution there, but you got to get a group together around the patient. The patient doesn't know what to do if they get cancer. It's like a one big hit you in the head. What do you do?
Can I piggyback? Walter's raised something so important, and I've noticed, and that has to do with whether patients are victims from the systems they're in, or they can develop a powerful and an informed approach. One part of it is you're looking at the research, which I think Stand Up to Cancer is doing, but the other side is the person at the middle, with like Lisa, who went out, who was on stage here and went out to do this. I know that's not your area, but I am interested in your insights on exactly what Walter just shared.
So we were looking at what we call the circle of care for a patient who's diagnosed with cancer. And it's not just that patient, it's the family. It affects so many people around. And you'll see us launching a clinical trial initiative where the awareness is not just for the patient, it's for the doctors, the nurses, the caregivers, and the family members. If you have one member of a family get cancer, it's everybody. And when you hear those three words, you have cancer, you shut down. It's so difficult for you to even listen to what the doctor is telling you. So having caregivers and having that circle of care help you during that cancer treatment trajectory is tremendous.
Interesting. Thank you for sharing that story, Walter. Yes, sir.
Hi, my name's Dana Oxley. I've lived here for 38 years. When I moved here, I was Red Fox's opening act. I did that for 11 years. Don't hold that. For the younger people in the audience, that was a TV show back in the late 1800s.
I know, yeah.
And I've seen a lot of change in Las Vegas. In 2005, our only then grandchild, Joey, was diagnosed with ALL. He fought as hard as he could, and I mean, the kid seldom cried and always laughed. And sadly, 2 years later, he passed away, and we were all holding him when he took his last breath. I didn't know it at the time, but I had cancer too. I had stage 3 squamous cell carcinoma on my right tonsil. Who gets tonsil cancer? I didn't even know that was a thing. The survival rates weren't all that great, but I wanted to thank Comprehensive Cancer Center. They're why I'm alive. That was Christmas of 10. The very next Christmas, I got kidney cancer. Totally unrelated, thank God it was not a metastasis, but Santa Claus was on my shit list for a while.
Yeah,
I've
totally understandable.
let him off the hook. When I was a kid, my dad taught me how to fly airplanes.
Right.
There was an organization called Angel Flight West when Joey was sick that came out of the woodwork, and they were going to fly him to his bone marrow transplant. And today we're talking about accessibility to care. And, you know, there's the old joke, where do you go in Las Vegas for quality health care? The airport. But it doesn't matter if you're leaving for treatment or coming for treatment, especially people in these outlying rural areas. Our division, angelflightwest.org, shameless plug, we fly anybody in need for free. And it sounds like it's too good to be true. And that's one of our biggest challenges, is convincing people that there really are no catches. We are a network of thousands of pilots in the 13 western states, including Alaska and Hawaii.
So great.
And
Such a
we
great
fly
story.
anyone with a compelling human need, not just medical, women that need to get away from an abusive relationship, doctors trying to get to underserved areas, kids going to various camps.
Right.
And nobody pays a penny. Everything is donated by us pilots, and nobody knows who we are.
Well,
So
now,
we'd like to
now
know
some
that
people
word.
do, and I'm extremely impressed. And as you know, you can tell from at least some of my questions today, I'm always interested in these ecosystems that develop. What helps them grow, like what you're doing? What hinders them from growing? How do you build literacy, particularly I think in rural areas that are outside some of the thoroughfares? So I really, really appreciate it. I wanted to get her comment real quickly, and then we're going to give Song a moment. Don't worry about that.
Okay.
An opportunity to finish up here. Yes.
Hi, my name's Izzy Thorne. I work at the Leukemia and Lymphoma Society. And you touched on briefly the importance of pharmaceutical companies collaborating. And I've noticed as a nonprofit, so many people reach out to us to see what we could offer, and we have a lot of great programs. But I know there are a lot of other nonprofits that it would be great to collaborate with because they offer wonderful things as well. And I feel like there's a bit of a disconnect there between the nonprofits and the services we offer and communicating that. So if someone calls in and I say, unfortunately, we don't offer that, but American Cancer Society or Stand Up to Cancer, and then the events we have, sharing that, what would you recommend is a great way to communicate? I know on an individual basis I've
So
been
how to
reaching
build
out.
a better clearinghouse?
Yeah.
Great. So, Song, you've heard both a life story about communities helping each other, and then the broader question about, you know, a smarter, more constructive clearinghouse. And I guess as we finish in your last remarks, would love you to address both of those. But I also, you know, am haunted by this kind of interesting question. What could Nevada, what could these efforts that we're doing around the country, what's the most important thing that you're not doing at Stand Up to Cancer that others might do to move us all in a better direction?
Yeah. So I think that, first of all, thank you so much for that question. We collaborate with over 31 nonprofit and government organizations. We pool our resources together, including monies, to fund translational research teams. So the DNA of collaboration, I think that needs to grow across all of the nonprofit organizations. No one organization can do it alone. And sooner we realize that the power of us all joining forces will be greater than anything one organization can do alone. What we would love in terms of partnerships is the fact that we get these therapies to the finish line. FDA approval with our pharmaceutical colleagues and our scientists, but all of these great therapies need to get to the patient bedside. So if you think about the fact that community hospitals take care of more than 76% of cancer patients, we at Stand Up need to do a better job communicating with them to make certain that every patient has access.
That's terrific. Ladies and gentlemen, Song Poblete, thank you so much for joining us.